here. Again, I want to thank you all for joining us 13 weeks into this community endeavor where we're updating you, the stakeholders in the community about the resettlement effort. We are 13 weeks already into this effort. We have had, and we will get an update on the number of arrivals, but we've had, we're almost a third way into the projected numbers that we, more than halfway into the projected numbers that we envisaged. The effort continues and will probably continue into early February. We have had arrivals. We've gone through the transitional housing. We've started putting a significant number of people into permanent housing. We are seeing people being already enrolled into schools. Several initiatives, people are already getting work. Some of them are celebrating the fact that they've had their driver's license and they're very well on their way to becoming part of this community, succeeding in this community. We are leading this and working with our partners to have this collaborative effort around resettlement, addressing challenges that, you know, at the time were not predictable, but that we're now having a better understanding of this massive arrivals and preparing ourselves even better for the next arrivals and learning as we go along and engaging even more people in the process. We are working collaboratively to address the main challenge of housing. We're beginning to find some inroads into that and obviously this is not a challenge that can be resolved by just one organization or in the short term, but we're finding some short-term solutions, and I know that there's been a lot of goodwill within the community about a long-term solution, which hopefully we're going to get there at some point. And so there's a lot of development that we can report on, and a lot of collaboration that is taking place in several organizations that are reaching out and helping us in this process that we're going to always be grateful for. And with that, I would say, like every other week, we're going to give you an update on numbers. And then after that, we're going to have open up for any questions that you may have. In the meantime, I can see. I'm going to turn this over to Blake, our Senior Vice President here for programs, Blake Hamilton, for our weekly update.
Thanks, Ray, and thank you all again for joining us for the 13th iteration of this meeting. Today, as always, we'll be going through our community update, our weekly update before touching on some of the super staff that we have on board and describing a little bit more the process of resettlement and the activities that are undertaken there and how we're partnering with various organizations in the region to tackle some of the challenges associated with resettlement. So in our next slide for the weekly update, this week is another light arrival week for us. We have 17 folks scheduled to arrive this week as of yesterday. We are expecting a brief travel moratorium, not the breadth of the time between the 24th and the 31st. We are expecting travel to be suspended on the 24th and 25th, as well as the 31st and the 1st. So this functionally marks the last full week of the year that we'll be seeing resettlement, and it is something of a light week That's 2 consecutive light weeks in a row, which has us sort of bracing for the inevitable rush that will occur after the first of the year. We do believe that if the federal government is intent on keeping its promise to wrap up this program as early as possible, that we'll see an increase of arrivals after the first of the year, which will more likely be closer on a weekly basis to our stated weekly capacity, which is 50 arrivals per week. But as Ray mentioned, we have resettled more than half, in fact, much more than half of our initially allotted 500 Afghan arrivals. We've resettled 345, I believe, of the allotted 500, which puts us at about 70% through the program at this point. We are at this point considering the possibility of opening up more slots in our region for resettlement through our office. We're right now in negotiations with our national partners. The National Voluntary Agency of ours is, of course, the USCRI, talking with them about additional financial supports that can be put in place in order for us to be able to commit to resettling more. And primarily those financial considerations go towards supporting both short-term and long-term housing. As we've mentioned almost every time through this, we have been talking about the housing challenge as being the primary challenge for us as we consider how we might be able to support more arrivals and support the folks that are here. What I can tell you is that this week in housing, we've had 6 more families be moved from hotels into apartments. This is fantastic development, and we're starting to see a little bit more of the connections that you all have provided for us sort of come to bear opportunities for housing. And so I want to again thank everybody on this call who's been a part of the effort to source housing. Every connection is very important to us as we look to expand the network of property management agencies and individual developers or even landlords that can connect to provide housing solutions. So at this point, we have about 129 folks currently in hotels, and 216 are in their own housing. And those are individuals, not cases, obviously, at this point. Did want to take a moment to further highlight some of the collaborations and how our partners have been able to support our clients over the last week here. We have partnered with the House of Goods and come to an agreement with them for food service over the holidays. They'll be providing dinners to our clients in the hotels on the 24th and the 25th, as well as the 29th, 30th, 31st, and the 1st. So we're very appreciative of the collaboration. And this is a part of our wider collaboration with the Islamic Foundation. And we are currently working with the foundation around connecting with our command center to provide a larger regularized commitment around an MOU for supporting resettlement, as all of our collaborators around the command center have done or in the process of doing. And likewise, we invite any organization that is interested in committing volunteer services or any sort of regularized service to connect with our command center. We are creating MOUs around those relationships based on the ability of any individual organization to provide supportive services related to resettlement and care for our new Afghan arrivals and all of our arrivals. We are currently working with 4 organizations and really would welcome opportunities to connect with any other groups of volunteers or networks that are interested in formalizing the relationship with us. Why do we need a formalized relationship? Well, the fact of the matter is we have we're working on a very short time frame with very sensitive information with very vulnerable individuals. We also has been noted to us that there are cyber attacks that are being launched to resettlement agencies nationwide in an effort to take information, personally identifiable information, and sell that, and possibly leading to the imminent physical safety being threatened for family members that are back home. And so we are taking every precaution, including signing confidentiality agreements with our partners in order to maintain the safety of that information that is passed back and forth in service of of our clients. And so the best way that we can think to govern this is by engaging in an MOU, which clearly outlines the duties and responsibilities for maintaining that data safety in our communications and relationships. So again, if any organization on this call is interested in connecting and formalizing their relationship with us, we'd very much appreciate that. You can reach out to either myself or Carlos Suarez at our command center. Additionally, in terms of collaborations, we have worked with Latter-day Saints, the Relief Society, on donated blankets that they've been dropping off this week, as well as $10,000 in gift cards, which are going to go a long way towards supporting the material needs of our new arrivals. Very appreciative of that collaboration. Additionally, we are in the middle of a coat and shoe drive distribution at this point, which was led by CFNA, and we received donations likewise for this event through the Captain Elementary Girl Scout troop. So no organization too small or too young that can't get connected to support the needs of arrivals. And we're very thankful for the leadership of those organizations, and want to thank Al Buckman, who's on the call here today from CFNA. And also take a break here and give some time to Al and to Carlos to talk a little bit more about that drive and the distribution effort. Al, Carlos?
Go ahead, Al, if you want to take the floor.
Carlos. Okay, can you hear me all right now?
Yes.
Okay. Well, just a little bit. We put out an appeal to about 35 congregations and partner organizations. And within less than 10 days, they had provided about 200 coats and over about 400 pairs of shoes. So volunteers got them pretty much cataloged and made them available for distribution. That distribution, the first part of it happened 2 days ago at the extended stay. And I think that about 50 people, I believe, Jacqueline or Carlos, you can check those numbers, received coats and shoes. We presently have 3 more. We call them giveaways. We invite new Americans in. We stage the things that we have, a lot of household use items, also coats and shoes and more, and then invite new American families in to pick up what they need. And 3 more are scheduled between now and Christmas. And in fact, there'll be one this evening at the Peace Center, and that will be for the Afghan. They will be invited to be over there and pick up additional matters. Carlos, I don't know if that helps or that provides the information you want, but.
Yeah, no, thank you, Al. And we really appreciate you and CFNA on this opportunity. And yeah, there was about 60 individuals that were served that day. And we had a great support of your team, as well as our colleagues here at the International Institute. And as you know, as far as we know that all the clients were dutifully served and were able to select items that serves them well. And it was really nicely organized by size, by gender. So everything worked out really smoothly. And as a result, it sounds like we're looking at hosting these at the other 2 hotels where we have clients as well. So this one was at Extended Stay America, which was really smooth and successful. So thank you again.
Okay, and we'll look forward to information on the other 2. And we have coats and shoes left over, of course, so they're available.
Thanks, and thank you to all the folks who participated in these drives, and thank you CNFNA for the distribution as well. You know, this came from identifying needs based on partnerships, right? We've come together around the table to talk about what we are seeing as service providers and identifying these needs and mobilizing solutions to meet the needs of the folks that we're serving. So, you know, we invite more to come around that table to help identify these needs and help in satisfying them. I do want to turn to cash assistance. We have been soliciting donations that are going directly to support new arrivals, and that is through what we call our TOW fund. The TAO fund is designated funds specifically to support cash assistance needs for new arrivals. And we are using these funds in a way that we have not really previously. We have been using these to support our hotel stays as well as food for new arrivals until they get to their own housing, which then is paid for out of their individual resettlement accounts. And we've seen on a weekly basis now over the last month or 5 weeks or so, as we've seen arrivals increase to the point where we've had to provide housing temporarily at hotels, that the costs associated with this are about $24,000 per week for the hotel stays and $17,000 per week for food. These are costs that we happily incur, frankly, in order to make sure that we are properly feeding and properly housing folks until we're able to get them into their own housing. We have been targeting hotels with kitchenettes to allay some of these food costs. We are providing transportation once a week to the grocery store for clients staying in hotels, so that they might be able to shop for items that they can use, or those folks that are staying in locations with kitchenettes might be able to prepare their own foods. And these are funds that we've been collecting since really prior to Afghan resettlement. These are funds that are, again, made available to all new arrivals, not just Afghans. But we appreciate each and every organization and individual around this table who has very generously donated their funds and wanted to make sure that everybody was aware of sort of these costs that are incurring. Now, as we look ahead, of course, any costs associated with any increased number would need to be factored in. And so these are sort of the numbers that we're using as we evaluate whether or not we'd be able to extend the funds that have been donated over a time period that would be required to resettle more folks. So we're essentially calculating these costs as about $41,000 a week, based off of our weekly arrival numbers that we think will be closer to 50 again as we go forward. But every time somebody gets themselves into housing, of course, these numbers go down, and we fully expect that most arrivals will need the support of these funds for up to 3 weeks while we source housing and prepare them to move into that housing. So that is just more of a deeper dive into the use of funds and the costs associated with temporary housing and feeding while we get folks into permanent housing. And this does break down to about $100 a day for meals and hotel stays for individuals. So another way to consider what a donation gets a client when it goes directly to our TAO fund. We do not expect to have to expend the entirety of the TAO fund on temporary housing and food. Those funds are also to be made available to clients for a variety of needs, including utility payments or extra rent assistance once they do get into housing. These are also emergency funds that are used to cover emergency medical bills for those folks who maybe need emergency medical services who are not yet enrolled in publicly available funds. We do have at this point, several pregnant women who are in the hotels who we have been working to obtain healthcare costs or healthcare for, and those costs have been charged to the TAO fund at present. So there's a wide variety of costs associated with the TAO fund. And we're, again, very thankful for every dollar all of you have contributed to it. And I really appreciate amplifying the message about how these funds are being used to support new arrivals. We can loop back for on any questions for this, but I'd like to move on to highlighting the work of our resettlement team over this period. The data has started to come in nationally around the work that was done in the month of November. Nationwide, I believe there's something up like 7,000 folks were resettled in the month of November. But for us, we talk about these numbers, we talk about the work, but I wanted to take a moment here to highlight the team that's actually engaging in this work. So we've talked previously in these meetings about resettlement and what resettlement is. But we have a resettlement team, and that team is comprised of people who do work and provide services on a daily basis to folks who need it. We don't want to generalize and talk about the work of the Institute here. We really want to talk about the work specifically of the resettlement team. So the resettlement team consists at present of about 11 individuals. So that includes 4 case specialists, 2 housing staff members, 1.5 AmeriCorps members, and 3 administrative staff. This is the team that is primarily responsible for meeting the resettlement needs, providing resettlement assistance for all of our new arrivals. And since September 1st, that means 401 individuals. While we've had 345 Afghan arrivals, we also have seen refugee arrivals as well in a limited capacity in the earlier part of the year, of the resettlement year. But functionally, we have a caseload of 400 individuals for 4 case specialists. And I've included here dates next to each of the names of the individuals. And those dates are the actual date of hire for each of these folks. So as you can see, the vast majority of folks who are providing direct service are new staff, are folks who've been hired since September, when we did receive our initial round of funding to help prepare for new arrivals that allowed us to hire staff and build capacity prior to these folks coming. Of course, that was not necessarily as early as the federal government intended, as the fallout of Afghanistan really kind of sped up the timeline for things. So what we have at present are 4 case specialists: Mehdia, Najib, and Tim. These are the folks who've been going to the airport, doing 24-hour home visits, checking in on folks who are in those hotels, providing access to medical resources, and a wide variety of services that are listed on the right-hand side of this page. So 4 case specialists for 401 individuals is incredibly enormous caseloads, and we do have plans in place to expand this team, and likewise could use your assistance in advertising those open positions that we currently have on our website to help provide a little bit of relief for this group of folks as they are working, again, primarily as the resettlement caseworkers on addressing a wide variety of needs. And actually recently, Tim has moved into a new role for us. Tim is now our intake and assessment specialist, helping folks as they arrive identify which programming is available to them, and also doing a little bit of benefits resource navigation for folks and helping them get connected to benefits that can, again, assist them in resettlement. So we're looking to fill Tim's role and hire an additional case specialist. So functionally at present, this team is actually 3 case specialists. Our housing staff are working with following up on the leads that many of you have provided to us, connecting with landlords, talking about what support the Institute offers our clients in housing, making arrangements for initial payments, and marshaling support of our volunteers in doing these housing setups, securing utilities, and putting those utilities in the names of our clients, and doing inspections on those properties prior to move-in. So with 2 staff members doing all of that work, we're very excited to announce that we actually have 2 additional staff members joining this team as of this week. Tomorrow, in fact, we will have 2 individuals working as both housing coordinators and housing assistants to help us with processing all the leads that have been coming our way, and making more connections with landlords to find and secure housing. We have 1.5 AmeriCorps members. How do you have a half a person? Well, many of us who work in nonprofits or fund nonprofits know exactly how that works. But if you're disconnected, half a person is merely 20 hours a week dedicated to a particular activity. And Kara at this point is working with us as an AmeriCorps, both in resettlement as well as immigration services. And so we're here counting her half relative to resettlement. And Jordan, likewise, is our AmeriCorps who's fully dedicated to resettlement. And at this point, his role is really connecting folks to medical assistants, our primary care physicians, as well as our health screenings as well. Our administrative staff are providing a variety of support to our teams. Ariel, as the Resettlement Director, who you all have met previously, and her breadth of experience and knowledge directs much of the work of the team overall. Shada likewise oversees our case specialists and provides support in arranging for hotel pickups, our stays, or pardon me, our case staffing assignments for each of our case specialists, as well as coordinating efforts with our volunteers to support our new arrivals. Ranga is our money man. Ranga helps ensure that each of our cases are getting their pocket money, that charges for those for the RMP, the resettlement accounts for each of the clients are getting attributed to each of those accounts. Rents get paid, etc. And provides a lot of that financial and distribution support, including donations and donation distribution to our clients. So I just want to introduce that team to you and give them a big shout out and a thank you for all the work that they've undertaken over the course of the last couple of months here. And then on the right, that is really sort of a listing of the required elements of resettlement, if you will. And so these are all the elements that our team on the left are undertaking, all the services that they're delivering on for our clients. These all seem very straightforward on their own, maybe, but I think the big challenge is the fact that many of these are actually time bound. So these are services that must be provided on strict timelines, generally speaking, though those timelines thankfully have been relaxed somewhat during Afghan arrivals, as a mean of providing us a little bit more flexibility in the delivery of some of these services, and providing, frankly, a little bit more space to triage the most important and pressing needs for individual cases. So I have also listed on some of these activities the organizations that are providing support through our command center model and through MOUs. For our housing setups, as I mentioned, we have Oasis providing support, use of their trucks and volunteers to help set up apartments. For our airport pickups, we have Oasis, Welcome Neighbor, and Christian Friends of New Americans who have signed on to provide assistance there. For 24-hour home visits, which is a required element that must be conducted immediately after arrival, we have Oasis, Welcome Neighbor, and CFNA providing that support. I should also mention that for these various activities and more, we have the Welcome Neighbors program for family support, as well as the International Institute's community support program, which are opportunities for groups of volunteers to provide more extended long-term support. They are, of course, welcome to help out with the delivery of these services through coordination with our team. However, our staff members are primarily responsible for the delivery of these services. And we are very much thankful for our partners who are providing this capacity for us. You can imagine case specialists who are responsible for so much can be quickly overtaken when we have a lot of housing and a lot of arrivals coming in because of how labor intensive those first couple of steps are. But that is not the breadth of their responsibility. The responsibility goes a lot deeper than that. Our resettlement team is responsible for providing all these services within the first 90 days of arrival. And that includes connection to health screenings. I want to share some news that our partners at Affinia are expanding the access to health screening, which previously was available only once a week here at the Institute. This will now be available 2 more times a week to help, again, address the backlog. They can only see so many folks a day, given the volume of services that need to be provided during those health screenings and the volume of tests that need to be conducted. So we're very thankful that they're opening up and partnering with City Health to be able to provide more days of health screening. This will, again, allow us to serve the backlog, but also provide timely access to health services. The health screening is really the first interaction with a healthcare professional that many of our folks have had since coming off the bases. At the bases, the limited healthcare was available, including immunizations. However, this is really a central component of addressing more chronic health needs that might exist within our resettlement population. Community orientation is another opportunity for volunteerism. We've had volunteers in the past assist us with this. There's a prescribed curriculum for community orientation. However, folks that volunteer through Welcome Neighbor or volunteer through our own community support program have the opportunity to play a little bit more of a partner role when it comes to community orientation, provide a little bit more personalized experience. When folks are placed in neighborhoods, they'll need access, understanding of neighborhood resources, where's the nearest grocery store, gas station, pharmacy, etc. And this sort of community orientation on an individualized basis is really great when conducted with community partners. However, the community orientation as it sort of formally stands is a classroom-based experience, which we've made more available to more folks through mobile means. And we are working with our partners, as stated, to ensure that all of our clients arriving are getting computers and hotspots to facilitate their own sort of community integration at their own pace, finding jobs, getting their kids connected to school. Schoolwork, which now, as we all know, is conducted over the internet when the terms demand it. So this is a critical component, not just to delivering this community orientation, but providing connectivity for our clients with the rest of the community. The rest of this list, obviously I could go on and on about each of the things. I will spare you, but this presentation will be going out to you all. And if you do have any questions about these services or about how your organization might be able to connect to help us deliver these services effectively, efficiently, and confidentially to our clients, we'd very much be interested in talking more about that. So just to personalize this a little bit, looking at our list here, you can see that Mehdia was actually hired in the middle of November. And as I mentioned before, November was the busiest resettlement month in the history of the resettlement program, not just in St. Louis, but in the United States. And as our state refugee coordinator thankfully pointed out, there are 16,000 folks that were resettled nationwide in November. For us at the Institute, I believe that was 249 individuals that were resettled, with 248 of those folks resettled in the last 3 weeks of the month. So that is an enormous task, especially considering in 1 week we had 154 individuals arrive. So Mehdia, as somebody who really jumped in to the fray, I just want to point out what her first month kind of looked like here at the agency. On her first day at the agency, she was accompanying staff for an airport pickup. Less than optimal. Of course, we want to get folks connected to orientation and training prior to engaging in service. Mehdia has language skills that were very useful that day. I was with her at the airport, actually welcoming some new cases. She really jumped right in with both feet and made herself available, and for that we're very thankful. After that day, we were able to give her a little bit of a reprieve and get her connected to more training and onboarding. And she did receive training and onboarding for 8 days before being assigned her first case for case management. Now, generally, we've been trying to hold off on getting folks connected for new staff members connected to individual case management for 2 weeks while they go through training and orientation. But of course, these were very extraordinary circumstances. And Mehdia, thankfully, of course, is a quick study and a very compassionate individual, and was very able and willing to jump in with case management. She worked each of the first 3 weekends she was hired all the way through the weekend. She did receive overtime pay and extra time pay for that work. But again, this is indicative of what we're asking across all staff as we were attempting to meet the challenge of the day. But this was not a requirement of the position, but we're thankful that she saw a need and jumped in and was able to devote time and energy over her first 3 weekends to get the work done. So over this period, Mehdia has been assigned 25 cases now, and that includes 99 individuals, some living at hotels and others at apartments. We have actually 12 different locations, apartment locations where her clients are staying, as well as the hotels. So you can imagine how busy she is traveling between these locations to visit her clients, and that's not work that can be done on a daily basis, visiting with 99 individuals and ascertaining need and delivering service. So She is making her rounds, and it certainly is not as quickly as we would all like, but given the volume and her being one person, we're really hoping we can expand her capacity by hiring new staff to reduce her caseload, so hopefully she can make those rounds on a more frequent basis. I would point out as well that her caseload includes 14 children that are 2 years of age or younger. And these children are going through health checks, but also arranging for childcare, or arranging for school enrollment for the older kids, of course, but also childcare for the children in a place that's culturally appropriate for those youth. Many of the families that we're seeing are coming with concerns about, of course, childcare being conducted by somebody outside of the family or outside of the home. But as we're able to allay those fears, there's also concerns around whether or not halal meals will be available for children who are going into daycare facilities that offer meals, or what language support is available in childcare facilities or even at the schools. So as we're heading into sort of this next phase of resettlement, we're seeing something that is really very common, but focused on families turning to the attention and care for the children in those families, and the support systems that are in place to facilitate access to education and just good childcare options that are both culturally and linguistically appropriate for those families. And so Mehdia has faced a lot of challenges in her first month, as all our staff have. And I really just want to extend a big thank you to all of our staff members in Resettlement who've been providing so much important work and service, and a thank you to all our community partners who are helping extend the capacity of our team by providing volunteer support. We really always say that we can't do what we do without the support of the community, and that is true in so many ways. But never has it really been more evident than right now when it comes not only to the financial needs of our clients, but also the physical needs and the socio-emotional support that our volunteers provide by coming in with a smiling face and an open attitude. They're really creating a welcoming environment that we talk about so many times, and are putting a human face and a personal touch on what it means to be welcoming. We are always working to be more welcoming as a community, looking at examining our policies and procedures. That means publicly available services are available to the largest number of people, regardless of their language ability. But we also know that nothing can replace that personal touch of welcoming by establishing a connection with our new arrivals. And so I welcome you all to join us in this work and partner with us as we have a long road ahead. Though we have 70% of our Afghan arrivals in at this point, we will be turning next to the 1,000 refugees who will still need to be resettled once Afghan placement ends. And so there's no limit to the amount of support that we are hopeful to engage in with community organizations and individuals who want to support our new arrivals. So with that, I'll take a breath and say, turn it back over to Ray. Thank you.
So thank you very much, Blake, for that update. Just following up on that shout out for our resettlement team that really they have performed miracles in this process, and hopefully the moratorium that we're going to have during the holidays should give them some breathing space. But yeah, we're very, very grateful for the incredible work that they have done. Just a few things that I want to highlight and clarify as a follow-up. And I know that I've had several times this question come up. All donations that are received at the Institute are donations, and those donations go to the people that we serve. There is no cost on donations. And so I just wanted to clarify that donations are donations. They are what they are, and all of it is intended for the people that we serve. Secondly, with reference to volunteer support, this is really, we're building this coalition, and I think we've taken some first steps into this process. We've seen support from our partners with airport pickups and setup, and it's a learning process. we're all going to learn, but the more we get them involved, the more the burden is lighter for, as you have seen, our case specialists who have really taken a lot. So I think leveraging the support of the command center within this short term of arrivals, of significant arrivals, will really be helpful. So I know Carlos has shared the updated phone number, and his email as well is in the chat for contacts. I keep saying the more organized a group is to support us, the better. So it's really good to have this group engagements and as in the process. Highlighting as well, I just want to also highlight this question of meals, and if there is a group that would want to step in for the holidays and support the hosting of meals, we can coordinate that. But we have seen how significant the cost has been, and we're doing all we can to ensure that the cost of their transitional stay isn't factored into the stipends that they have. So we're really leveraging the support of the community in this regard. We have been the last month or so covering all of that cost, and whilst it's been working out because we had a lot of support on the front end from the community, we really started beginning to think about how sustainable this can be. You know, as this is going to continue until February. So maybe this is something that we could address as a need. If there's a group, an organization that wants to pick up days, weeks of providing the lunches or the meals, I think that would be a great thing. We can coordinate the suppliers or restaurants or catering services that we've been using to be able to provide that food. But that's one way in which we can get help through the holidays. And finally, I know there is ongoing conversation because we're beginning to see all of these families showing up. There is need for us to start thinking about having a daycare on our premises for these mothers and women to be able to be involved in other activities so that they can be successful, and at the same time we can provide support to them for the children. So that may be something that we will be coming back to the community and figuring how we can get resources, supplies to really design and create a befitting daycare for them, and allowing the women to also be successful, to get involved in English language and do other things that will help them prosper in this community. With that, we're open to any questions from the audience. I see a few questions have been dropped there. I'm not sure, Blake, whether we have the answer for Betsy's question, that for those who have been moved into apartments, can we, off the bat, say what percentage is in the city as opposed to the county?
As a percentage, roughly, I'd say 80% to 20%, 8% in the city, 20% in the county. We've had some very large cases that have actually been resettled in the county, some extraordinarily large cases, I'd say. So when we talk about percent, it gets a little murky, but roughly 80-20.
Thank you. Thank you. Any other question that I may have overlooked? I know Nikki had a question with reference to volunteers being looked in through the command center, and I think that has been addressed.
For individual volunteer opportunities, we actually in the last 2 weeks have put quite a few more on our website. So I would encourage, and I do have the link in there to our volunteer opportunities page. Right now, we are really seeking help with bus training. I mean, that has been a big challenge for us, in terms of getting more people acquainted with the buses. We have bus passes to give out, but we have folks who still need to go through orientation on using the bus. And we have traditionally had opportunities for volunteers to help with that. So if you or anybody in your organization be comfortable providing training on using the bus and public transportation in general, we would really like to get people connected to that opportunity as a sort of a priority for us.
Great, thank you, Blake. Any other questions? Well, seeing none, well, we're going to continue building this collaboration. I would obviously want to give a shout out to our folks at Oasis, Welcome Neighbor, working on this collaboration with the Islamic Foundation, and in that regard, House of Goods, the folks at CFNA, Al and your team. Thank you so much for the incredible support that we're getting. I know later on today we're receiving this support from the Latter Day Saints, the blankets and $10,000 in gift cards. All of this is what is making this resettlement effort successful. Challenges, obviously, they are enormous challenges, but we're working together. We're finding solutions as a community, and I think that's really what we must celebrate, especially during this holiday. So we can't say thank you enough, but I must say thank you, and we'll be back again next week. Maybe not, but we'll let you know as soon as possible, because I know that we're inching into the holidays. And yes, a big shout out, which I did last week, for the 500 socks that we got from the National Council of Jewish Women. These opportunities just keep coming. So thank you very much, and have a great week.